Hi, I'm Dr. Dagny Zhu and I'm a LASIK surgeon in Southern California. I've been wanting to react to this scene for the longest time. It's a woman who undergoes LASIK surgery in Final Destination 5. So let's take a look.
What's with these?
Oh, just for some of our younger patients. And sometimes our older ones too. Come on.
So she's clearly very nervous. We don't have a wall of teddy bears for our patients, but we do offer them warm blankets. And if they're really nervous, I actually have them hold my surgical tech's hand and I tell them to feel free to squeeze it as hard as they want. It really helps to calm them down. But actually, all of our patients do get a sedating medication about 30 minutes before the surgery. So most of them feel very relaxed, very calm, almost in a dreamlike or even drunk-like state. But they're still awake and they can follow my directions, they can hear my voice, and they can do what I need them to do. If I had a patient like her, I would probably have her sit outside for a bit longer, maybe give her more medication so she was more calm before we proceeded.
Who's that?
Relax. You know, it looks a lot worse than it really is. Okay, I'm gently going to position your head. And I want you to tell me when this feels snug.
I can't move my head.
Perfect. Just what we want. There we go.
So I have no idea what that thing is. When we do LASIK surgery, we don't restrain the patient at all. You're actually free to move your head, your body. Obviously, I'd prefer if you didn't, but we don't tie you down with anything. So that medieval looking device is completely fictional. Obviously, they just added it for the movie for a scare factor.
Okay, now comes the fun part. Here comes the drop, and you will feel a little numbness in your eye, which is a good thing.
So we do use a numbing drop. It's called proparacaine. It's an anesthetic. And when we put it in the eye, it does burn and sting for a few seconds, and then the eye goes completely numb. Patients describe it as a heavy feeling in their eyelids and their eyeball. And that numbing eye drop does last for the entirety of the LASIK surgery. And so there's no need to use any oral or IV anesthetic. So it's very straightforward.
Deep breath. Relax. Very good. And a girl. There.
Okay, so that is an eyelid speculum, and we do use that to hold the patient's eye open. It's not half as scary as they make it seem. The eyelid speculum just gently stretches the eyelid to keep it open so the patient doesn't have to worry about blinking during the surgery. A lot of my patients worry that they're going to close their eyes and then the laser won't work, but there's really no way that you can blink or close your eyes during the surgery because I'm holding it open with that eyelid speculum. And it's not painful at all. You just feel a little stretch on your eyelids is all.
That's not so bad, is it?
So that's the laser. Typically when they're under the bed, the patient sees a green blinking light, and that's the light that I have them focus on for the entirety of the surgery. The part where we actually do the laser treatment, they'll start seeing lots of bright lights for a few seconds, 10 to 20 seconds. They don't feel anything at all. And during that entire time, I have them just stare at the green blinking light. That's all they have to do. Again, it's completely painless. They don't feel any of the laser treatment.
Good.
What was that?
Just relax, Olivia. I'm just going to enter some data into... Dottie? Dot! Do you know what? My assistant's giving me an incomplete file. I'll be right back.
Hold on, you're leaving? So, a doctor would never leave a patient halfway through their case with their eye open like that. The preoperative data should already be entered into the computer ahead of time. And we do have surgical techs who help us. So if we did need anything, one of them would fetch something for us. There's really no need for the surgeon or no reason for the surgeon to ever leave the patient's side at any time. That's very highly unprofessional. And I feel sad for this poor girl here. Why would you ever have a water cooler next to your laser equipment? That would just never happen. That's totally a safety violation. And if that were to happen and the water got to the laser would probably shut down. The energy would not continue to increase for no reason. So that would not happen in real life. Obviously, this is a movie. This is their, terrible fate. But just so you know, in real life, that would never happen.
Is that supposed to be happening?
A few things here. First of all, we do have an emergency stop button on the laser. I've never had to use it. Second of all, in real life, this patient would never be strapped down, so she would be free to walk off the bed and out of the room at any time. Third of all, the laser has a lot of safety mechanisms, one of which is a pupil tracker. And so the laser detects the pupil at all times, and it only fires if the pupil is in the correct location. There's no way that it would fire on any part of the body that it's not supposed to. For example, her eyelid or her hand, because the minute that the patient moves or the pupil becomes out of the field, the laser stops. There's no way to activate the laser firing. And also, the only way to activate the laser firing is with the surgeon's foot pedal. We step on a foot pedal and the laser fires. As soon as we lift off the foot pedal, the laser stops. So there's no way that it would fire on its own. And here, there's no way that it would fire on any other part of the body that it's not supposed to, because the pupil tracker tracks the pupil within milliseconds. And so once the pupil disappears, laser stops. And finally, the way that the laser ablates is basically painless and very clean. There's no char at all, as you see there as it's cutting up her hand. There's no char. It basically invisibly and very cleanly polishes the cornea. Some patients describe like a smell almost. It smells like a little smoky, but there's absolutely no residue of char. You can't really see any after effect of the laser, like a scar, for example. And again, it's completely painless.
Olivia Castle, where is she?
She might be in danger.
No, she's fine. We do this kind of procedure all the time.
Oh my gosh, that part gets me every time. So I've really never seen a laser suite above the first floor, and maybe that's why, but as you can see, even in this scene, she didn't die because of the LASIK surgery. There's really no way LASIK can directly kill a patient. She tragically, fell out a window to her demise. And then the way that they depicted the eyeball falling out of the eye socket, that would never happen. Secondary to blunt trauma from a fall. You would never have a clean enucleation with disinsertion of the optic nerve from the orbital socket like that from a fall. So that would never happen. And the poor little eyeball got squished in the end by the car. I mean, that was just Hollywood fantasy, at the 10,000 level. So very entertaining, but not at all realistic. So thank you guys for watching. I hope you learned a little bit more about LASIK, what does happen and what does not happen. Please feel free to ask me if you have any more questions. Thanks for watching.